Alrighty, so we're going to start our subjective refraction. We want to make sure we clean our phoropter first, bring the patient in, have them sit in front of the phoropter. We're going to level it for them, occlude their left eye, and have the right eye open. And then we want to make sure we put some type of objective lens in place for the exam. So we start with the gross sphere. We're going to add 0.50 diopters. Click, click. We're going to ask the patient, do they see better, worse, or the same? If the patient says they see the same or better, then we're going to go another click, click, another plus 0.50 diopters. Until the patient says they see worse, then we're going to go back 0.50 diopters and stay there. Now, if in the beginning of the exam we added the 0.50 diopters and the patient said that they see worse, then we're going to go back to where we started, look at their visual acuity. If it's at 20/30, then we have room to go back, put a minus 0.50, go back 2 clicks, and then from there we can verify. If they're seeing clearly, then they can stay there. If they're not, then we want to put them back in the position we were in the beginning. Next, we want to verify their astigmatism. We're going to look at their cylinder axis, and so we're going to bring the Jackson cross cylinder unit in front of their eyes, and then we're going to put it in a straddle position on the axis where the red dot and the white dots are at a 45 degree, which now we have position 1 and position 2 on which side the red dot is in. And so I want to say clockwise, we're going to go, or counterclockwise, depending on if the patient says in position 1 they see better, or position 2 they see better. The thing you have to keep in mind is they're not going to be seeing 20/20, they're going to be seeing 30, so let them know that we're not trying to see if they can see clearly, but we're just trying to compare what they're seeing, so they can let you know is position 1 better or position 2 better. And then from there we want to do asking them and then moving the axis. So if they say position 1, then we're going to move the axis about 15 degrees in position 1, and then if they're still saying position 1, once it's moved 15 degrees, then we do another 10, we do 5, we do 2 to 3. Until the patient's saying on both position 1 and 2 they're seeing the same. Then we move on to the cylinder power. We're going to do the same, but we're going to move the axis position to a parallel position to set the cross cylinder unit to power, or the P on axis. And so now position 1 and position 2 still matters, but what happens is in position 1 there's going to be a red dot. If you see a red dot in position 1, then that means you're going to add a quarter to the minus cylinder power. You're going to add a quarter of a minus cylinder power. But if you pick position 2 and underneath the P it's a white, then you're going to add a quarter of plus minus. You're going to add a quarter of minus cylinder power. You're going to do this until the patient is able to read. And so we're going to do binocular balance next. If you're 20/20 on both eyes, we could do it. 20/30, one eye 20/30, one eye 20/20. We can't. What we're going to do, we're going to fog both eyes by adding 0.75 diopters. But if you're still seeing clear, then we're going to add 0.25 until you're not able to see. Then we're going to occlude each eye. You should be seeing blurry on both. We're going to add 0.25 if you're seeing clear on one eye. But if you pass 3 or 2 times that you're still saying you see clearly in that eye, we over minus. But if you're saying you see blurry on both, then we know we did our job right. And then so for the fine sphere, we want to ask the patient, are they still seeing blurry because of the binocular balance we were doing? Confirm on the chart that they're not able to read it, and then we're going to add a minus 0.25 binocularly on both spheres, just to start clearing things up. And then once the patient says they barely could read, but they could read a couple of words, then we're going to add a minus 0.50, 2 clicks back, and then the patient should be able to see optical infinity. That's it.